Hello, everyone, and welcome to this presentation on an introduction to stroke as part of the content for the ENIGMA-U series. My name is Stuti Chakraborty, and I'm currently a PhD student at the Neural Plasticity and Neurorehabilitation Lab at the University of Southern California. Today, we are going to learn a little bit more about stroke. What is a stroke? As you might be aware, blood vessels carry oxygen and essential nutrients to different parts of the brain. In fact, our brain is one of the largest consumers of oxygen and nutrients produced within the body. A stroke occurs when such a blood vessel, primarily an artery, is either blocked by a clot or it bursts or ruptures. Now, when this happens, there is an interruption in the nutrient and the blood oxygen supply to a particular part of the brain. When that part of the brain cannot get the blood and oxygen it requires to function, it results to death of the brain cells. Let's look at some quick statistics to appreciate the extent of stroke. 80% of strokes are actually preventable, but it is still the fifth cause of death and the leading cause of disability within the United States. 101 million people worldwide are living with the aftermath of stroke. And around the world, one stroke occurs in every 3 seconds. So as you can see, it is definitely a very serious and important condition to be aware of. It's important to be aware of the clinical signs and symptoms of stroke so that in case someone is having one, you are able to intervene and save their life. And it can be anybody. You don't need to be a healthcare professional or an emergency frontline provider to save someone's life. It can be you. So the first one is B, and it can be abbreviated as the B fast signs and symptoms. The first one is B, which is balance. You might notice the person having a sudden loss of balance or sudden loss of coordination. And then E, which stands for eyes. You might see the person experiencing sudden blurred vision or double vision or even a loss of vision altogether. F stands for face drooping. You might see the person experiencing drooping or numbness on one particular side of the face. A stands for arm. The person might have a weakness or numbness in their arms or even their legs, which is localized generally to one side of the body, and they might not be able to lift their arm or their legs when you ask them to do so. S stands for speech. They might have a slurred speech, or they might be unable to speak, or they might even have difficulty in understanding and interpreting what you are saying. And T stands for time. So stroke is a very time-sensitive condition. As soon as you notice someone having a stroke, you must intervene immediately and call the emergency service number within your country. Some of the other symptoms to also be aware of are sudden numbness, like I said, weakness or feeling numb within the face, not just in the limbs, which is especially localized to one side of the body or the face. They might have a confusion, difficulty in understanding what you're saying, or even difficulty in expressing themselves. And then they might also have a severe headache, which is usually without a known cause. There are different types of stroke. The first type is ischemic stroke. It occurs when a blood vessel which supplies blood to the brain is occluded. Ischemic strokes are actually the most common type of stroke and account for about 87% of all strokes. The main and the most commonly known cause of ischemic strokes are atherosclerosis. So what is atherosclerosis? It develops slowly as cholesterol, fat, blood cells, and other substances in your blood form a plaque. When the plaque builds up, it causes your arteries to become narrow. This in turn reduces the supply of oxygen-rich blood to tissues of vital organs within the body, especially in the brain. So imagine atherosclerosis occurring inside a water pipe. When there is accumulation of debris and rust within a water pipe, it becomes difficult for the water to flow because of narrowing within the water pipe. Similarly, within our blood vessels, as there is deposition of fat and atherosclerosis and plaque buildup, the lumen or the lining of the blood vessels become narrow, as a result of which it becomes difficult for the blood to flow through these blood vessels. And this leads to obstruction within the blood vessels, which ultimately leads to stroke, which is commonly seen in case of ischemic strokes. Now, there are different types of obstruction these fatty deposits can cause. And the two major types of obstruction are cerebral thrombosis and cerebral embolism. Cerebral thrombosis is a thrombus or a blood clot that develops at the fatty plaque within the blood vessel. whereas a cerebral embolism is a blood clot that forms at another location within the circulatory system. Usually, it is large and it enters into the heart and the arteries of the upper chest and the neck. A part of the blood clot breaks loose and enters into the bloodstream and travels through the brain's blood vessels until it reaches vessels which are small, and so the clot cannot travel through anymore. A main cause of embolism is an irregular heartbeat called as an atrial fibrillation. It can cause clots to form in the heart, dislodge, and travel up to the brain. So, what is an atrial fibrillation? Normally, your heart contracts and relaxes to a regular beat. In atrial fibrillation, the upper chambers of the heart, that is the atria, they beat irregularly or quiver instead of beating effectively to move the blood into the ventricles. If a clot breaks off, it enters into the bloodstream and lodges in an artery leading to the brain, resulting in a stroke. Here we have two pictures. The first picture denotes a thrombus or a blood clot in a local blood vessel, which obstructs the flow of blood within the blood vessel. The second picture depicts an embolus, which moves through the bloodstream, and when it becomes lodged in the blood vessel, as it narrows, this causes an embolism. We have included here a video which you can watch to learn more about atrial fibrillation and how it relates to strokes. The next type of stroke we are going to talk about is a hemorrhagic stroke, which is also known as a bleed. This occurs when there is a rupture of a weakened blood vessel. The vessel bleeds into the surrounding areas within the brain, which is known as an intracerebral hemorrhage, or between the brain and the skull, which is known as a subarachnoid hemorrhage. Hemorrhagic strokes account for about 13 to 20% of all strokes, and they can actually result from poorly managed or ill-managed high blood pressure. Let's look at some more details of intracerebral hemorrhage. In an intracerebral hemorrhage, the bleeding occurs from a broken blood vessel within the brain. Some things that increase our risk for this kind of hemorrhage are, like I said, high blood pressure or hypertension, heavy use of alcohol, advanced age, and the use of drugs like cocaine or amphetamines. In the subarachnoid hemorrhage, there is bleeding from a damaged blood vessel causes blood to accumulate at the surface of the brain. The blood fills a portion of the space between the brain and the skull, which mixes with the cerebrospinal fluid that cushions the brain and the spinal cord. The cerebrospinal fluid is also an important fluid which supplies nutrients within the brain, and it actually washes the brain when you're asleep. As the blood flows into the cerebrospinal fluid, it increases the pressure on the brain, which causes an immediate headache. That's why you might see some people who are suffering from an hemorrhagic stroke actually complain about having a headache. In the days immediately following the bleeding, chemical irritation from clotted blood around the brain can cause brain arteries that are near to this area to go into a spasm. And artery spasms can also result in brain damaged tissue. As we saw, hemorrhagic strokes can occur because of weakened blood vessels, and these are of two major types. The first one is an arteriovenous malformation. This is an abnormal formation of blood vessels, usually in a cluster. And the second type is because of cerebral aneurysms. This is a ballooning of a weakened region of a blood vessel. We're going to look at these in some further detail. The first type is an arteriovenous malformation. Now, under normal circumstances, arteries carry blood containing oxygen from the heart to the brain, and veins carry blood with less oxygen, or rather deoxygenated blood, away from the brain and back to the heart for purification. When an arteriovenous malformation, or AVM, occurs, there is a tangle of blood vessels in the brain, which bypasses normal brain tissue and directly diverts the blood from the arteries to the veins. These malformations often occur in the spinal cord and also in any part of the brain or on its surface, but can develop also in other parts of the body. AVMs can damage the brain and spinal cord by reducing the amount of oxygen reaching the neurological tissues, bleeding into the surrounding tissue. It is congenital, that is, it occurs at birth, and is seen in less than 1% of the population. They are more common in males than females. So, a brain AVM contains abnormal, therefore weakened blood vessels that direct blood away from the normal brain tissue. These abnormal and weak blood vessels dilate over time, and eventually they may burst to form high pressure of blood flow within the arteries, resulting in a hemorrhagic stroke. So in this picture, you can see the red vessels are the arteries, the blue vessels are the veins, and the pink or purplish colored vessels actually depict a mixing of the arterial blood with the venous blood in the case of an AVM. The next thing is cerebral aneurysm. We usually don't know why an aneurysm bleeds or exactly when it will bleed. Some of the known causes which increase the chance of this cerebral aneurysm to bleed are high blood pressure, which is the cause of subarachnoid hemorrhage. Heavy lifting or straining can cause pressure to rise in the brain, and this may lead to an aneurysm or rupture. Strong emotions such as anger or being upset can also raise the blood pressure and can subsequently cause aneurysms to rupture. As you can see in this picture, the pointer depicts a ballooning of a weakened artery, which results in the artery becoming very weak and wide. And when there's a sudden rise in the blood pressure or a high blood pressure, it can rupture. There are some other types of stroke that you should be aware of. The first one we're going to talk about is a transient ischemic attack or a mini stroke. But it is really a major warning, so it should never be neglected. A TIA is a temporary blockage of blood flow to the brain. Because most TIA symptoms last from only a few minutes up to 24 hours, they're often dismissed and not taken seriously. However, this is a big mistake, and TIAs can actually sometimes signal a full-blown stroke ahead. Anyone can have a TIA, but the risk of TIAs increase with age. If you've previously had a stroke, pay careful attention to the signs of TIA because they could signal a second stroke within the future. The common signs and symptoms of a TIA are actually similar to that of a regular stroke. And some of these are weakness, numbness, or paralysis on one side of the body, blindness in one or both eyes, or loss of vision or blurry vision, dizziness, severe headaches with no apparent cause. The second type of stroke is a cryptogenic stroke. In most cases, it is caused by a blood clot blocking the flow of blood to the brain. But in certain cases, it cannot be detected despite testing. Hence, it is known as a cryptogenic or a hidden stroke. Then the third type is a brainstem stroke, which is also known as locked-in syndrome. A brainstem is actually one of the major structures within the brain. It is only a half-inch diameter, but it controls a lot of the basic activities of the central nervous system, like consciousness, blood pressure, and breathing. All the motor control for the body flows through the brainstem. Brainstem strokes can impair any or all of these functions. A more severe brainstem stroke can cause something known as locked-in syndrome, a condition in which survivors can only move their eyes and communicate through their eyes. So this infographic actually shows what happens in case of a locked-in syndrome. Most people with locked-in syndrome cannot consciously or voluntarily speak or make any kind of facial expressions, produce any body movements below the level of their eyes. They cannot chew or swallow. However, they can move their eyes up and down, sideways, horizontally and laterally, and they can also blink. But also, all the people with locked-in syndrome can hear, have normal sleep-wake cycles, think and reason, and also comprehend people talking or reading to them because all the structures above the brainstem, that is the subcortical and the cortical structures, are intact. And so a lot of people with brainstem strokes actually use alternative augmentative communication techniques through which they are able to communicate. Now we're going to look at the management of strokes. For ischemic strokes, the first line of approach is using a recombinant tissue plasminogen activator or RTPA, which is given within the first 4.5 hours to perform an intravenous thrombolysis in order to clear the clot which occurs in an ischemic stroke. Apart from this, another procedure which is done is a mechanical thrombectomy, which occurs in case of a larger vessel occlusion, which can be done within the first 6 hours. The management of hemorrhagic strokes usually requires surgical management because the rupture and the bleed is very large. The first procedure which is done is known as coiling. it is a procedure in which a fine tube or a catheter is inserted into an artery in the groin and then carefully steered up to the aneurysm near the brain all the way. X-rays are used to guide the tube, and tiny platinum coils are passed through the tube and placed within the aneurysm. More coils are then added until the aneurysm is properly sealed. Clipping is a procedure which involves removing a small flap of bone from the skull and using a titanium clip to seal the aneurysm. After the clip is in place, the piece of bone from the skull is replaced and the scalp is stitched together. Some of the leading risk factors of stroke are actually lifestyle dependent. So if we modify our lifestyle, stroke can actually be prevented. The highest risk factors are elevated blood pressure, poor diet, high body mass index, that is the weight to the height ratio, or obesity, high fasting glucose, air pollution, and smoking. As mentioned, factors like poor diet and high cholesterol can lead to the formation of clots or plaques or atherosclerosis and result in ischemic strokes, whereas risk factors like high blood pressure can cause hemorrhagic strokes. So the prevention of stroke is definitely lifestyle dependent, like I said. So you must try to avoid the heavy consumption of alcohol, smoking, consumption of junk foods with high cholesterol foods, and a poor diet. Try to always maintain regular exercise, physical activity, good cardiovascular health, and a diet which is rich in nutrients and vitamins, and also maintain a good body mass index. Thank you so much for watching this presentation.